Hi everyone, this is Mikey. I'm one of the AVC registered nurse student, and I'm here to show you how to start an IV Alaris pump. So today we're gonna show you how to do a primary and a secondary pump infusion. And on my hand is a sheet that you could download from Canvas. This is gonna be your guidelines, a step-by-step guideline on how to prepare an infusion system and how to set up an IV pump. So this is going to be available for you from Canvas to be printed. After you print this, you will go ahead and practice for 1 hour. And for you to practice for 1 hour, you're going to go get your IV kits, IV pump kits. So the IV pump kits will look like this. So it's going to include all the things that you need for you to practice for the IV pump. So for you to get this, just go and find me or anyone who works here in the lab so you could sign these off so you can practice. After you practice, you will go ahead and submit this to Miss Dickinson, and she will check you off that you practice for 1 hour. And after that, you're going to go ahead and schedule your check-off for the IV pumps. Okay. So after you schedule your check-off, they will give you, on the check-off day, they will give you a scenario. Scenario could be anything, but it's always going to be a primary and a secondary infusion. So each will have a math problem that you have to solve. So here, this is how it looks. So I'm going to show you how to do the math, okay? So for this, the primary provider ordered a primary infusion of 1,000 ml of normal saline to infuse over 12 hours. This is going to be your primary infusion. Your secondary would be this. It says IV piggyback of ceftriaxone, 1,000 milligrams in 100 ml to infuse over 45 minutes. Alright, so I've set up a problem and a solution here. This is going to be your primary. So it says 1,000 ml to infuse over 12 hours. So this is easy. You're just going to divide 1,000 over 12. And it's going to give you 83.3 per hour. Since we're doing adult, we're going to round it off to 83 ml per hour. This is how you will set it up on your pump. So this one's going to be your secondary. So the order is 1,000 milligrams over 100 milliliters. So the way I do it, I always start with what's needed. Since we need a mils per hour, you always put the milliliters on top. So I put 1,000 100 over 45 minutes times 60 over an hour. So this is how we do it. You multiply the top and you multiply the bottom, and whatever's your product on the end, you just divide it, and then you will end up with this answer. So it's 133.3 ml per hour, and then round it off to the whole number. It's going to be 133 ml per hour. So this is going to be your infusion rates for your primary. It's going to be for your secondary. Alright, now I'm going to show you how to prepare an infusion system. So first, you're going to verify the order of your doctor. So you're going to go check your computer and see if the bag is actually ordered by your physician for the patient. So I've checked that. Now I'm gonna go to my patient, take a look at him. Hey, hello.
Hi.
Hi. Can I verify your name and date of birth, please?
John Smith, February 2nd, 1969.
Alright, thank you. So this is actually a good opportunity for you to tell them what you're gonna give them. So, Mr. Smith, we're gonna give you an infusion of normal saline in a bit. So, I'll be right back, okay? So before you leave the room, make sure that the bed is down and your patient's safe. So I'm gonna go check the order and my computer if I actually have the right patient for the right order. So once I've checked that, I'm going to select the supplies that I need. So for this, I have a primary tubing, the ordered primary bag, which is normal saline, 1,000 milliliters, alcohol pads, label for my tube, for my bag, alcohol caps, and flush. Okay. after that, I'm gonna make sure my hands are clean. So I've already washed my hands, but to be sure, always get some hand sanitizer to clean your hands. And while you're doing that, you always have to think about your 6 rights of medicating a patient. So right dose, right route, right time, right patient, right medication, and right documentation. Okay? Alright, so with this process, you don't need to use your gloves yet since you're only preparing the bag and the tubing. But once we get into infusing it, you actually have to put your gloves on. So I'm gonna open the bag. It's already open. So while you're opening it, make sure that it's not expired, that it doesn't have any puncture or any cloudiness inside. So this is good. Normal saline, if it's the right bag that you are ordered for. And after that, you're going to open your primary tubing. Actually has a line, so it's easier for you to tear it. That. Okay, and then make sure you clamp it because they always come unclamped. So just clamp it as soon as you take it off the bag. And since I already have the label for the tubing, might as well put it. So primary tubing and secondary tubing usually last for 72 hours, depends on your hospital protocol. So since today is the 6th, it's gonna expire on the 9th. It's gonna be 72 hours. So make sure you put your initial on the time and date. So I usually put it here under the chamber. I like putting my gloves on when I spike the bag because you want to make sure that the tip of the tubing, the spike itself, is sterile. Okay. Gloves on. Alright, so now I'm ready to spike my bag. I'm just gonna so we have to make sure that this stays sterile. I'm just gonna twist it back and forth until you actually puncture it in. There you go. Okay. Now you're ready to hang it. And you're gonna pinch it to fill up the chamber. So just pinch. There you go. And we'll go ahead and prime it. So for you to prime, for priming, you just need to unclamp this part. You can leave this with the cap, or you can loosen it up a bit so the solution actually flows. So we're gonna see if it flows. So it's flowing good. So I didn't need to take it out. Priming is just to make sure that there's no air in the bubbles. I mean air in the line. There's no bubbles in the line. So once you see that there's no air in the line, you can go ahead and clamp it again. And your primary bag is ready to infuse. Alright, now I'm going to show you how to set up the IV pump. So I've already verified the order, the patient, and the medication, and the infusion. I've already calculated my infusion rate. So just keep that in mind. So now you're going to put the tube in the pump. So we call this the brain and we call this the channel. So you're going to open the channel. From here, you just pull it and it should pop out easily. And then this is gonna go here. And this is gonna go here. There we go. So you see that when you close it, just make sure the space is actually filled. And as you close it, just push it down. Okay. So we're gonna set this aside. Now we're going to the patient. We're gonna go to Mr. Smith. Hey, Mr. Smith, we're here. We're gonna go ahead and infuse your normal saline. So you're going to check the IV site for inflammation, for redness, for infiltration, for phlebitis, or anything that's abnormal. For you to do that, we're going to go ahead and have a flush for to check patency of both Y sites. It's going to be your Y sites. Alright, so we're going to put the bed up. Okay. So we'll go ahead and wipe the white side for about 15 seconds. Make sure you have the friction. Alright. Okay, make sure there's no bubbles. You prime the 3 mils normal saline. Okay. As you push the normal saline, make sure there's no resistance, and you're gonna ask your patient, Mr. Smith, do you feel any pain? No? Okay, good. You're gonna touch the side if it's cold. Check if it's leaking. So this one's good. So obviously it's infusing. Okay. Okay. So now we're ready to put in the primary tubing that we prepared. Before everything else, you also make sure you swab the Y side again. So just always swab before you infuse. Swab before you put the tubing on the patient's IV Y side. So 15 seconds. Okay. We'll take this. Tip for this, like students are having a hard time taking this off. It actually takes off when you pull it like that. So you don't rotate it. So just pull it down, like snap it. Okay. I've already swabbed my Y side, so I'm ready to snap in it. Alright. So after that, we're gonna go back to our pump. We're going to turn it on. So for you to turn it on, just push system on. So it's going to turn on. Okay. So it's asking if we have a new patient. So we'll pretend that Mr. Smith is not a new patient. So we'll just hit no. And we're actually in ICU, so just say yes. So it says here, since we only have one channel, it only shows one channel right here. For you to select the channel, you don't press here, you actually press on the channel itself. So press channel select, And you're going to have the options if you're infusing drugs, IV fluids, or just basic infusions. So remember, we're ordered to infuse IV fluids of normal saline. So you're gonna normal saline. So you're gonna press this. Was selected. Is this correct? So you're gonna press yes. Okay. So now remember the rate ordered. So for this, it's 83 mils per hour. So you just go ahead and put 83. And then volume to be infused. VTBI means volume to be infused. So usually for 1000 mils, I usually put 950 or 900. We do this so nurses will have ample time to get a new bag if it's still ordered. So you actually don't run out. Okay? So just double check that you have the right rate and the right volume to be infused. And then if you already verified that, you're just gonna go hit start. It's right here. And make sure that your clamp is unclamped. Because if it's not, it's going to beep. I'll show you how it sounds when it beeps. Right there. So it's saying that it's included, patient side. So for that, if you hear that beeping, you always check the line if it's clamped, if the patient is actually including the IV site, and if it's not, just go ahead and press restart. Alright, so now we're done with the primary infusion. Now I'm going to show you how to do a secondary infusion. Alright, so I have my antibiotic right here. 1000 milligrams of ceftriaxone and 100 mils IV piggyback, and our secondary tubing. If you notice, it has a hanger and it's actually shorter. Alright, so I'm gonna open my secondary tubing. So first thing I always do is clamp it. And so we have this hanger. The purpose of this hanger is for you to put your primary bag lower. So I'm going to clamp it like that. I'm going to put this lower. We're putting this lower because this is the heavier bag. So you want the heavier bag to go lower than your antibiotics, since you want this infusing first before your normal saline bag, which is obviously bigger. Okay. So, like the one that we did for the primary, we're also going to prime this antibiotic. So I've already made a label, so I don't forget. I always put it on the tubing already, even before I prime it. So like again, I usually put it here. I put the date, the time, and my initials. 72 hours also for secondary tubings. So I'm going to snap. Like the primary tubing, you also want this to be sterile, okay? So just gonna roll back and forth until you get half. Okay. So you're gonna squeeze. Alright. So when priming secondary, you want to slowly release it so you could lessen the turbulence on the tubing, so you would have lesser chance of getting bubbles or air in the line. So I'm going to loosen this up. It's infusing slowly. prime it until you see the tip. Or like until you see a drop on the end of your tube. Since it's antibiotic, you don't want to waste a lot of it because you want the whole medication to go to your patient. In any case that you see bubbles, I'm gonna show you how to troubleshoot that in a bit, okay? So we're gonna go ahead and find the port nearest to the secondary, which is this one. And we're gonna go and swab it. So like I said, anything you infuse to the port or any ports, white side or primary ports, you always swab it with alcohol before. So 15 seconds, make sure you have friction. Alright. Okay. So as I was saying, go ahead and clamp it. In any case you see any air on the line, we have this thing called back prime. So back priming is taking your secondary bag and putting it lower than your primary. So once I put this lower, you will see any bubbles that's stuck in your secondary to go to your chamber. Okay. Since we don't have a lot of bubbles on the line, we're not gonna back prime it as much as we can because we want to make sure that the volume of your secondary stays accurate. Okay. Alright, so now we're ready to infuse our secondary. So for you to infuse that, you're gonna go back to your channel, so channel select, and then you're gonna find secondary. And it's going to give you an option of the antibiotics or medications that you would want to infuse. So since we want ceftriaxone, we're gonna hit A to E. Yeah, you're gonna press page down and just find ceftriaxone. Make sure that it's the right medication that you're giving the patient. And this one does not have the default of what concentration we have. So we have to manually put it. So if you want to put it manually, just pick that and then say yes since we're putting it manually. So drug amount would be 1,000 milligrams over 100. So we're going to press next and hit duration. For these machines, they usually ask for the duration more over the rate. So for this one, we are ordered to infuse it over 45 minutes. So I'm just gonna put 45. All right. So since you've calculated your rate, just make sure the rate that you calculated reflects on the rate that the machine is telling you. So in this case, it's 133. So we already calculated that it's 133. So we verified that. So make sure that your volume to be infused is 100, since it's the we want the whole 100 to infuse. So you verified that. Just press start. Okay. So you're gonna see. Make sure that you see the chamber, that you see drops dripping. That's gonna be the sign that your infusion is actually going through.